So can you just bring us up to speed with where our numbers are at?
So good morning. So over the last 24 hours we've had another 33 cases, 6,322 cases by my early morning report. So that's continuing the current trend, which has been positive with a reduction in the number of cases. But I do emphasise that it's not time to be complacent. This is a highly infectious virus. And it's far too early to think about moving any restrictions at the moment. We won't know for a week or 10 days what's happened with people moving around over Easter, although we believe people have generally behaved well. So it is a good trend, but this is a really infectious virus, as we've seen just in northwest Tasmania with a large outbreak in recent days.
What's the rub with those lower numbers at the moment, Brendan? Is it down to less testing, or is it down to fewer people going to get tests or tests being available? What's the answer to that?
No, the testing availability is good. The clinics that are open are reporting significantly fewer number of people turning up. That's probably because we've seen a dramatic drop-off in respiratory infections overall, even including flu and colds, probably due to the social distancing, which is great. So we don't think that there's been any reduction in the availability of testing, although we've got to be careful with Easter that some clinics mightn't have been open as much as they were. But we have heard reports over the last week that whereas previously there were lots of people queuing up for testing, some of the clinics have been pretty quiet, which is good because it means people haven't got respiratory symptoms.
Brendan, ultimately it's your call at the moment with what goes on as the Chief Medical Officer. Can you enlighten me with what conversations are being held at the moment behind the scenes? So
it's not, my call, it's a nice way of putting it. I chair the Australian Health Protection Principal Committee, which is also advised by many experts. So advice that we provide to the National Cabinet, which is the Prime Minister and all the Premiers, is considered advice that's come between perhaps 30 or 40 people. So it's considered consensus advice. The decision makers are essentially the National Cabinet. So at the moment, the sort of discussions we're having is the need to stay the current course for some weeks. It's far too early to relax anything. But if we do get continued good trends, and particularly focusing on that community transmission number, the number of cases without an epidemiology link, if we see that really fade away to almost nothing, there may be possible to have discussions about changing the balance between restrictive measures versus public health measures. If we had really, really good and extensive testing and screening and strong public health measures, it might be possible to revisit some of the restrictions. But these restrictions in some form or another, as we've said for many times, are going to be in place for months and months. There's no possibility of large-scale relaxation in the short term.
Can you give me an example of how a measure might be relaxed?
Well, I think one of the things that the National Cabinet has been quite keen to do is to get children back to school. Some states are obviously more keen than others, and we have yet not seen evidence of significant student-to-student transmission in schools. So we are working with some advice for the National Cabinet on how schools can be made a safer environment to prevent transmission if it does occur between children and to protect teachers. So that's one very important measure that the National Cabinet is keen to get advice on.
What about something that doesn't involve students?
Well, I think, the size of gatherings is obviously a measure that some states at the moment, South Australia has a legislative restriction on 10, other states have 2. It may be possible to have some discussion about consistency across that. Those are the sort of things, but I wouldn't want to preempt the sort of measures that we're considering because we're not talking about doing anything in the short term. We need to stay the course in the coming weeks.
Brendan, I'm curious about, we've got to be careful with whatever comes out of China. But when it comes to Wuhan in particular, they didn't ease restrictions until first they got to 0 new reported cases, and then they held that for 14 days to kind of choke off the disease. Is that a measure that could be considered here?
That elimination approach is the sort of thing that New Zealand is pursuing, and that is one option for a country. The challenge in that particular scenario is that you still have a population which is largely non-immune, so you are at continued risk of reimportation and the spread of new outbreaks. So it's a very tricky position to be in because you have to maintain extraordinarily strong border controls.
So maybe it could just be a state-by-state first, and then, I mean, I'm guessing international travel is a long way off, that kind of thing.
International travel is certainly a long way off, yeah.
Brendan, we just had the sports minister then, and I asked him about the return of the NRL. He said the NRL is being very, very ambitious at the moment. Again, he referred to the health authorities to make that decision. When do you think would be a suitable time that they could look at restarting sporting leagues?
Yeah, look, I think it's premature at the moment. I would like to watch the data over the next 2 to 4 weeks before we want to make any recommendation about that.
So at about the time that they think that the start of the league should happen is when you should consider when the start of the league should be happening?
I think we just need to watch the data more closely. I'm not involved in the discussions with the NRL. I know some of the state health departments are, but I do think at this time right now it's a bit premature to be calling on a date.
All right.